Every year, millions of people over 60 take steps to protect their heart. They walk, they watch what they eat, they take their medications. And most of them have no idea that one factor, something determined before they were born, is quietly shaping their risk profile in ways their doctor has probably never mentioned. A study published in the European Journal of Preventive Cardiology found something cardiologists are still debating. People with blood type O, the most cardiovascularly protected of all four types, had worse heart outcomes than people with blood type AB, statistically the highest risk type. The only difference between them? One group moved. The other didn't. Today, we're going through what the peer-reviewed science actually says about each blood type after 60. Not folklore, not blood type diets. The clinical evidence and what it means specifically for you. And stay with us until the end, because the final finding contradicts something you're about to hear. Before we go through each type, here's the biological foundation, and it matters. ABO blood type is not just a label on a medical record. A landmark genome-wide association study, published in PLOS Genetics, confirmed by research in arteriosclerosis, thrombosis, and vascular biology, a journal of the American Heart Association, established that ABO antigens are expressed not only on red blood cells, but on the cells lining your blood vessels, your gut, and your lungs. They influence how readily your blood clots, how your immune system responds to inflammation, how your body metabolizes certain fats, and how strongly your stress hormones react to perceived threats. Blood type is one genetic variable among many, but it's one that tells you precisely which risks to monitor most carefully after 60. Before we continue, do you know your blood type? And has a doctor ever told you what it means for your health? Write it in the comments right now. Your answer might be the most useful thing someone else reads today. Blood type A. People with type A blood have a consistently documented higher baseline cortisol response to acute stress. Their body releases more cortisol in response to a perceived threat, and that cortisol takes significantly longer to return to baseline. This was confirmed in controlled laboratory settings published in the journal Psychoneuroendocrinology. Over time, chronically elevated cortisol is directly linked to reduced hippocampal volume, the brain structure central to memory and learning, to increased abdominal fat, to higher blood pressure, and to impaired immune function. For people with type A blood, stress regulation is not optional self-care. It is a clinically relevant health priority. Here's what the research supports specifically. 10 minutes of diaphragmatic breathing each morning. 4 seconds in, 6 seconds out. A study in Frontiers in Human Neuroscience found a 23% reduction in baseline cortisol after 8 weeks of daily practice. That is not a trivial number. Type A is also associated with modestly higher rates of gastric cancer and type 2 diabetes in several research cohorts. The evidence-based priorities for type A after 60, consistent daily stress regulation practice, annual monitoring of fasting insulin and HbA1c, and the highest possible fiber intake in your diet. If you have type A blood, did you know about this cortisol connection? Write it below. Blood type B. Type B is associated with higher susceptibility to certain bacterial infections, particularly urinary tract infections caused by E. coli. The mechanism is specific. B antigens interact directly with bacterial adhesion proteins, making it easier for bacteria to bind. Type B is also associated with a modestly higher risk of pancreatic cancer compared to type O, and in women, with higher rates of ovarian cancer in some research cohorts. At the same time, type B shows lower rates of certain cardiovascular events compared to types A and AB, which is a meaningful protective signal. The priorities for type B after 60 are practical and specific. Adequate hydration, a minimum of 1.8 liters daily, directly reduces bacterial adhesion risk in the urinary tract. At your next routine blood test, request hs-CRP and fasting insulin. And if you have any upper gastrointestinal symptoms at all, request H. pylori screening. Type B. Did you know about this bacterial susceptibility? Write your experience below. Blood type AB. AB is the rarest blood type, and the one with some of the most striking research findings in the context of aging. A large study published in the journal Neurology, using data from the Regards cohort, found that blood type AB was associated with a significantly higher risk of cognitive impairment compared to all other blood types. The proposed mechanism is elevated Factor VIII, a clotting protein. At higher levels, it can produce microscopic clots in small vessels that, over time, progressively impair cerebral blood flow. This same elevated Factor VIII mechanism makes type AB blood the highest risk type for venous thromboembolism. Blood clots in the veins. A systematic review and meta-analysis published in 2025 in the Journal of Thrombosis and Hemostasis confirmed that non-O blood types carry a 2 to 3 times higher VTE risk compared to type O. Type AB sits at the top of that range. This is particularly relevant for older adults during long journeys, extended periods of reduced mobility, or following surgery. The priorities for type AB after 60. Physical activity is your primary tool. It directly reduces circulating Factor VIII and von Willebrand factor. Know the symptoms of deep vein thrombosis, swelling, tenderness, warmth, and redness in the leg. And ask your doctor about a baseline MO-CA test, cognitive screening that gives you a reference point. Type AB. Did you know about the cognitive risk? Or is this the first time you're hearing it? Right below. Blood type O. Type O is the most common blood type globally, and in many ways the most cardiovascularly protective. Type O is consistently associated with the lowest risk of arterial blood clots, the lowest rates of venous thromboembolism of all 4 types, and lower levels of both von Willebrand factor and Factor VIII activity. But that same lower clotting tendency comes with its own specific risks after 60. Type O individuals are significantly more susceptible to peptic ulcers caused by Helicobacter pylori. The mechanism is direct. H. pylori binds preferentially to O antigens on the stomach lining. This is consistently documented across multiple research cohorts. Type O is also associated with increased bleeding tendency, something that becomes clinically relevant when discussing anticoagulants or anti-inflammatory medications with your doctor. On the protective side, type O is associated with lower rates of pancreatic cancer compared to other blood types. The priorities for type O after 60. If you have any history of acid reflux or digestive discomfort, proactively request H. pylori testing. A stool antigen test is non-invasive and straightforward. When discussing any blood thinning or anti-inflammatory medications with your doctor, always mention your blood type. And don't let the lower cardiovascular baseline become a reason to underestimate the importance of movement. Here's why. Now, the finding I told you at the beginning contradicts what you've been hearing. Everything we've covered describes your baseline risk profile, where your genetics place you before behavior enters the equation. But behavior changes the equation entirely. Research published in the European Journal of Preventive Cardiology found that sedentary individuals with type O blood, the most cardiovascularly protective type, had worse cardiovascular outcomes than physically active individuals with type AB blood, the statistically highest risk type. Read that again. The genetic advantage of type O was completely overridden by inactivity, and the genetic risk of type AB was completely overridden by movement. Physical activity directly addresses the biological pathways through which blood type elevates risk. It reduces circulating Factor VIII, the primary mechanism behind type AB's cognitive and clotting risk. It reduces von Willebrand factor. It lowers inflammatory markers including CRP. It reduces baseline cortisol, the primary mechanism behind type A's long-term risk profile. And it maintains vascular endothelial function across all 4 types. The evidence-supported minimum, 30 minutes of moderate intensity movement 5 days per week, combined with at least 2 sessions of resistance activity each week. For those with limited mobility, Chair-based resistance movements done consistently produce measurable reductions in the same coagulation and inflammatory markers as standard exercise. Here's one you can do right now. Sit on the front third of a firm chair. Inhale through your nose. As you exhale, rise slowly to standing, pressing through both feet, hinging from the hips with your back straight. Pause 2 seconds at the top. Inhale. Exhale as you lower with control. 10 repetitions, twice daily. This activates the calf pump mechanism that directly reduces venous pooling, one of the primary pathways through which sedentary behavior elevates clotting risk in all blood types. Everything we've covered today is on screen right now. Take a screenshot or download the free reference guide from the description below. Your blood type profile, the associated risks, and the priority actions all in one place. Here's why keeping this matters. Most people hear information like this, feel a moment of clarity about what they should do differently, and then that clarity fades. The next appointment comes, the moment passes, nothing changes. But with this reference in your hand, at your next doctor's visit, you can say something specific. Not, I read something about blood type, but I have type AB blood, and I want to discuss Factor VIII, baseline cognitive screening, and my physical activity targets. Or, I have type O blood, and I want to test for H. pylori. That specificity is what turns information into action. And action is the only thing that changes outcomes. Your blood type gives you a clearer picture of where to focus. But the most powerful thing you can do with this information is combine it with the one behavior the research shows overrides genetic risk entirely. The next video on your screen goes deeper into exactly that. The 6 specific behaviors found in people who age significantly better than their chronological peers, regardless of their genetic starting point. If this changed how you think about your health, subscribe. Next Tuesday, the answers most doctors won't give you. Stay strong, stay safe,